what happens when a brain aneurysm ruptures and what are the immediate consequences?
So depends on how much of amount of bleeding has occurred. There are grades. If the minimum grade, minimum bleeding, patient will have excruciating headache, vomiting, followed by persistent headache. That is where they report to the doctor. Such patients ideally should reach the right specialty, and that is only neurosurgery where they should reach, because we know that if CT scan is falsely negative because of a small amount of blood, but if the presentation is very classical, then we take out some amount of fluid from the spine, which is called lumbar puncture. If it is blood stain, that is also indicative of aneurysmal brain rupture and aneurysmal rupture, and then we do the angiogram in such patients. So that is the commonest presentation. If the bleeding is too much, patient may go into coma, might become drowsy, might have one-sided paralysis. So all depends on where is the aneurysm and where it has ruptured in the brain.
Okay. So, can a brain aneurysm affect a person's daily life even if it is not ruptured?
Usually not. As I said, only if it is big in size, it can cause paralysis of certain particular nerves, but otherwise aneurysm will not bother the patient till it actually ruptures.
Okay. So, what are the treatment options for aneurysm?
Okay, so when I was doing my neurosurgery, that is 30 years back, the only modality that my teachers practiced and for last 100 years was open brain surgery, wherein you would put a clip on the neck of the aneurysm. So if this is the artery and there is a outpouching from here, you put a clip. So no blood goes there, it will not rupture. But that was an open brain surgery. Now for last about 25-27 years, we have another form of minimally invasive procedure without opening the head or doing open brain surgery. You can coil the aneurysm. You can put the coil along with balloon assistance. You can also put the coil with a stent, depends on what type of aneurysm it is, which is a minimally invasive technique, and it is possible for lots many aneurysms now. There are certain aneurysms depending upon the anatomy, the shape, the surgery might be essential, but in most of the other aneurysms, coiling is very much possible. The way the treatment has transformed in heart diseases also, where from bypass surgery, many patients undergo the angioplasty, something similar to that.
So, how critical is the early detection of this, and how can we?
Very, very critical. One should not wait. If the aneurysm is more than 4 millimeter in size and is amenable to surgery and or coiling, the patient should be treated and not be left for devastating complications. Of course, if patient is say 80, 84-year-old, it's an incidental aneurysm, then you might still explain the pros and cons of not treating, and you can leave such aneurysm. It all depends on multiple factors, of course.
Thank you for the insights. I know this video will be very helpful for all our audiences.
My pleasure, ma'am. Thank you.